Please subscribe our channel. Press bell icon to get clavicle, also known as collarbone. Only long bone that lies horizontally. First bone to start ossifying. Ossify at 5 to 6 weeks of gestation. Only long bone which ossifies in membrane. Two primary centers of ossification. No medullary cavity. Three parts: sternal end, shaft, and acromial end. Conoid tubercle and trapezoid line situated in acromial end of clavicle. Clinical anatomy of clavicle. Most common site of fracture. Junction between two curvature of the bone. MCQS. The clavicle transmits the weight of the limb to the humerus, ribs, scapula, sternum. Answer: sternum. The clavicle is a flat bone, long bone, short bone, sesamoid bone. Answer: clavicle is a long bone. The anterior border of the lateral 1/3 of the shaft of clavicle gives origin to deltoid, infraspinatus, trapezium, sternocleidomastoid. Answer: deltoid. Scapula. It's also known as wing bone. Bone which has one primary center and 7 secondary centers of ossification. Clinical anatomy of scapula. Winning of scapula due to paralysis of serratus anterior. MCQs. Superior angle of scapula is covered by deltoid, latissimus dorsi, pectoralis major, trapezius. Answer: trapezius. One of the following muscles is not attached to the scapula: deltoid, latissimus dorsi, pectoralis major, trapezius. Answer: pectoralis major. Inferior angle of scapula is covered by deltoid, latissimus dorsi, pectoralis major, trapezius. Answer: latissimus dorsi. And humerus, longest bone in upper limb. The line separating the head from the rest of the upper end, anatomical neck. The narrow line separating the upper end of the humerus from shaft, known as surgical neck. Muscular attachment in bicipital groove. A lady between two majors. Lateral lip is covered by pectoralis major. Medial lip is covered by teres major. Floor is covered by latissimus dorsi. Clinical anatomy. 3 nerves are injured in humerus fracture: surgical neck, axillary nerve, radial groove, radial nerve, behind the medial groove, ulnar nerve. Common site of fracture: surgical neck, shaft, supracondylar region. MCQs. Which bony landmark is located on the lateral side of proximal humerus? Greater tubercle, trochlea, lateral epicondyle, lesser tubercle. Answer: greater tubercle. Which region of the humerus articulate with the radius as part of the elbow joint? Trochlea, styloid process, capitulum, olecranon process. Answer: capitulum. Radius. Radial artery is palpated as radial pulse. Lies on the lower part of the anterior surface of radius, that is lateral to the tendon of flexor carpi radialis. Clinical anatomy. Colles fracture. Falls on outstretched hand. Fracture 2 cm above the lower end of radius. Fractured end displaced upward and backward, produce damage to the medial nerve. It's also called dinner fork deformity. Most common complication of Colles fracture is malunion, Smith fracture, reverse of Colles fracture. Distal 1/3 of radius is affected. Fractured fragments displaced ventrally. MCQs. Which of the following muscle is inserted into radial tuberosity? Biceps brachii, brachioradialis, pronator teres, supinator. Answer: biceps brachii. Which is a common fracture of radius? Bennett's fracture, Colles fracture, Smith fracture, Barton fracture. Answer: Colles fracture. Ulna, stabilizing bone of forearm, is trochlear notch gripping the lower end of radius. Growing end is the lower end of ulna. Clinical anatomy. Made lung deformity. Dorsal subluxation of lower end of ulna due to retarded growth of lower end of radius. Monteggia fracture. It is a fracture of proximal 1/3 of ulna along with dislocation of head of radius. MCQs. Neck stick fracture is related to radius, ulna, humerus, carpal bones. Answer: ulna. Then carpal bones. Proximal row from lateral to medial. Scaphoid, lunate, tricutral, pisiform. In distal row, trapezium, trapezoid, capitate, hamate. MCQs. Largest carpal bone. Capitate, scaphoid, lunate, pisiform. Answer: capitate. Sesamoid bone is capitate, pisiform, trapezium, scaphoid. Answer: pisiform. Carpal bone which ossifies last. Pisiform, capitate, scaphoid, lunate. Answer: pisiform. Metacarpals. Shortest metacarpal is thumb. Clinical anatomy. TB or syphilitic disease of metacarpals is located in the middle of the diaphysis. MCQs. Fracture of base of first metacarpals known as March fracture, Bennett's fracture, Jones fracture, Saturday night fracture. Answer: Bennett's fracture. Rolando fractures is related to metatarsals, metacarpal, radius, carpal bones. Answer: metacarpals. Femur, longest and strongest bone, also known as thigh bone. Head of femur articulate with acetabulum in the pelvic bone. Blood supply. Head and medial part of femur is supplied by medial epiphyseal artery. Lateral part by lateral epiphyseal artery. Tibia, second largest bone. Nutrient artery to tibia is the largest nutrient artery in the body. It has 3 parts: proximal end, shaft, and distal end. The tibia is connected to the fibula by the interosseous membrane of the leg, forming a type of fibrous joint called a syndesmosis. Tibia is ossified from 3 centers: a primary center for the diaphysis and a secondary center for each epiphysis. Blood supply. Nutrient artery and periosteal artery that is derived from the anterior tibial artery. Then fibula. Fibula or calf bone is a leg bone that is located on the lateral side of the tibia. Fibula ossified from 3 centers. Ossification begins on 8th week of intrauterine life. Commonly injured nerve in the neck of fibula is common peroneal nerve. Patella, also known as kneecap. It is a sesamoid bone, triangular in shape. Apex of the patella facing downwards. Fusion is complete at puberty. Primary functional role is knee extension. It's also known as kneecap. It is a thick, circular, triangular bone which articulates with the femur and covers and protects the anterior articular surface of the knee joint. It is the largest sesamoid bone in the human body. Tarsal bones: calcaneus, talus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. Calcaneus: it is the largest tarsal bone. Forms prominence of heel. Talus: it is the second largest tarsal bone. Navicular: boat shape. Cuneiform: wedge shape. MCQS: the sesamoid bone of the lower limb is option A pubis, option B patella, option C ilium, option D calcaneum. Answer option B patella. Total number of tarsal bone in lower limbs: option A 14, option B 7, option C 8, option D 5. Answer option B 7. In adolescence, the Achilles tendon rupture often comes along with an osseous fracture of option A navicular bone, option B talus, option C calcaneus, option D cuboid bone. Answer option C calcaneus. Which bones belong to the distal row of the tarsal bones? Option A talus, option B cuboid bone, option C cuneiform, option D calcaneus. Answer option B cuboid bone. Total number of bones in lower limbs: option A 32, option B 34, option C 24, option D 36. Answer option A 32. Introduction. Larynx, located in the anterior compartment of neck, consists of 9 cartilages, extend from C3 to C6. The size of larynx larger in males than females. In males, the voice is deep due to the prominence of thyroid cartilages, known as Adam's apple. Development: 4th week of intrauterine life from foregut. Communication: inferiorly trachea, superiorly laryngeal part of pharynx. Skeleton of the larynx: 9 cartilages, 3 paired and 3 unpaired. Unpaired cartilages are thyroid, cricoid, and epiglottis. Paired cartilages are arytenoid, corniculate, and cuneiform. Muscles of the larynx: 2 types, intrinsic muscles and extrinsic muscles. Intrinsic muscles are cricothyroid muscle, posterior cricoarytenoid muscle, lateral cricoarytenoid muscle, transverse arytenoid muscle, oblique arytenoid muscle, and AIAPGET muscle. Extrinsic muscles are thyroid muscle, sternothyroid muscle, omohyoid muscle, sternohyoid muscle, digastric muscle, stylohyoid muscle, mylohyoid muscle, geniohyoid muscle, and hyoglossus muscle. Nerve supply. Motor nerve supply. All are supplied by recurrent laryngeal nerve except the cricothyroid, that is supplied by external laryngeal nerve. Sensory. Internal laryngeal nerve supply the mucous membrane above the level of the vocal cords. Recurrent laryngeal nerve below the level of vocal cords. Blood supply. Above the vocal cords supplied by superior laryngeal artery. It is a branch of superior thyroid artery. Below the vocal cords by inferior laryngeal artery is a branch of inferior thyroid artery. Lymphatic drainage. Above the vocal cords by prelaryngeal and jugulodigastric lymph nodes. Below the vocal cords by pretracheal and paratracheal lymph nodes. Please subscribe our channel. Press bell icon to get continuous